Polynucleotides are essentially fragments of DNA. The ultimate way is what I call a dermal restructuring.
If you've heard of the longevity Bible, Lifespan, by Professor David Sinclair, you know that living well is more important than just living long. In fact, this show is dedicated to the science of beauty, wellness, and longevity. That's why I'm so thrilled to partner with Melrose Future Lab for Season 9 of the Ageless Radiance Club podcast. Future Lab is Australia's first supplement range focused on extending not just your lifespan, but your health span. Available exclusively at Chemist Warehouse, these affordable and science-backed supplements are the key to aging well. Today, I'm excited to share Dr. Stephen Liew, a globally recognised specialist plastic surgeon and the founder and chief medical officer of Shape Clinic in Sydney. Dr. Liew is not only one of Australia's leading plastic surgeons, but also a recognised global leader in cosmetic facial enhancement techniques, a key opinion leader for skin technology and skincare brands, and the founder of Aesthetics Conference in Australia. Having trained as the first Australian Fellow in Plastic Surgery at the prestigious Memorial Sloan Kettering Medical Centre in New York, he specialises in both face and breast aesthetic surgery. Dr. Liew has also developed innovative non-surgical procedures that have revolutionised cosmetic treatments worldwide, enhancing his international reputation. Dr. Stephen Liew, this is a lucky day for me. I get to have the famed Dr. Stephen Liew on the Ageless by Rescue podcast. Welcome.
Thank you very much, Baha, for having me. I'm looking forward to it.
Last time I saw you, it was during the Aesthetics 24 conference. It's a 4-day extravaganza, isn't it?
Yeah, it was a 4 days extravaganza. I think you absolutely nailed it. It's a bit of a blur to me, unfortunately. I think it's about, 7 weeks now since we had Aesthetics 24. But thank you for attending.
It was my honor to be invited this year. Thank you very much. The reason I wanted to have you on the show, and I think this has been a few years in the making, is that there are very few experts in the aesthetic space that straddle regenerative medicine, surgical expertise, and aesthetic medicine. And you are a specialist plastic surgeon. You also have a very successful aesthetic medicine practice. And I know that you are a KOL for many brands and technologies. And of course, with the advent of aesthetics, the conference that you chair, bringing together the world of aesthetic physicians and professionals in the space, you are now really pushing forward into what it means to educate and innovate together in this space. For me, as someone who's speaking to a consumer audience, I would love to hear from you where you think the future of aesthetics is for the Australian market.
Well, thank you very much. Well, looking at the crystal ball, I think the future has to be, but I always believe in a combination of surgery and non-surgery. And that's probably the reason that I chose to be involved and be curious in the non-surgical arena. Well, since I became a plastic surgeon, back in 2001 when I first came home to Sydney, the non-surgical arena was still in its infancy. There was some great therapy going on. And then traditionally, as a surgeon, we focus on surgery. Everything is almost like everything. If you just have a hammer, everything looks like a nail eventually. Equally, if you are a non-surgical specialist, everything looks like a nail. You still have one tool. I think the future has to be, because the way that we age is extremely complex. One tool will never work. Fast forward 20 years now, look at what we have available to us. I think surgery will still have its role, a very important role. It's probably almost like the definitive way to deal with the aging process. But in between, there are a lot of things that will help us throughout our journey, because every one of us do reach that stage at some stage. And for those who are concerned, I think what I am particularly interested, and the buzzword has been, it's going to be a regenerative type of medicine. To give your audience a little bit of perspective in the non-surgical world, we always have devices. We have devices like laser to improve our skin qualities, and that's progressing very, very quickly. And then we have also the sort of a tightening devices, and we have seen them getting better. We're not there yet. And then we have the lifting devices that is very, very exciting. And I think we will see an explosion in that area, particularly dealing with the muscle, to deal, working on the muscle level. Regenerative opened a big area. Now, with aging, we see a lot of skin changes. We see the drooping. At the fat level, we see the loss of fat, and that's why we look a little bit gaunt, right? We're not as plump. And then the bone is probably the area still we have not have the technology to deal with. And I'll talk a little bit about the bone in a minute, because the bone is the foundation. If we can actually maintain the structural integrity of the bone, and I think we will hit it. And I think there are some things that we can do about bone. So if I forgot, please remind me. In terms of non-surgical, for a while now, we talk about a thing called biostimulation, right? So essentially what we do is we want to use something to stimulate our tissue to produce more collagen. Now, the end result is very good, and we have seen good product. And what it does is we get better skin quality, a bit of tightening, a bit of dealing with laxity. And the way it's done is by the process of creating an inflammation, creating a soft scar tissue. Now, by and large, it's still very good. But now, move on to 2024 in the next 10 years, we talk about regenerative medicine. Now, for the audience, think about stem cell. We all love stem cell, right? Stem cell is your ultimate regenerative property.
Your own stem cells, exactly.
Your own stem cells. People heard about fat injection, nano fat, because fat has a lot of stem cells.
And this is a really big area for splicing surgical procedures, is now using the autologous, matter, using our fat, using our stem cells to integrate into the surgical procedures. And now you're saying that regenerative medicine is also playing with nature.
Yeah. So regenerative medicine does a similar thing. So it is a man-made product, and the one in particular, polynucleotide. Polynucleotide are essentially fragments of DNA from the one that we have in Australia, from wild salmon, Pacific salmon. So from the reproductive organs.
I just want to interrupt there, because for my audience, what they may have heard of is the buzz and all of the media attention around salmon sperm and salmon sperm DNA. So that's what Dr. Stephen Liew is talking about now. So you may have seen the headlines, and they're obviously very, attention grabby. But the science behind it is what Dr. Stephen Liew is now going to explain to us, because it's not just a headline act. It's actually incredible science.
Yeah. So essentially, some clever scientists work out a way to extract the DNA and getting a specific component of the DNA and make it in the form that we can use on our skin. And it is completely natural, of course. What it does is it works communicate with our cells in our tissues so that it's starting to produce a lot of collagen, produce a lot of elastin, but also attract a lot of variety of growth factors. Growth factors are protein we all have. They concentrated into where we treat it. And the ultimate way is what I call a dermal restructuring. Dermal is your skin, but improve the integrity of the skin. One of the telltale signs of aging process is our skin become thinner. When your skin become thinner, become more transparent, easy to crinkle and wrinkle and produce lines and folds. So if we can think about cardboard analogy versus a piece of tissue paper does not require any force to create that permanent line. If we can restore that tissue paper into something more of a cardboard line, it's very hard to crinkle it. So that's the analogies I like to think about as restructuring, because it is almost like producing a new structure to the skin and something that is a lot more youthful. So
I want to interrupt here and just say, if I may, one of the things that I found about this technology that was really exciting to me as a consumer, and I've had a treatment that uses salmon DNA, is that I was actually for the first time able to treat, as you were saying, and this is what's inspired me to talk about this, the really thin skin under my eyes and even the really thin skin above my eyes. And I've never been offered a treatment that can go into those areas. Maybe PRP did it, but never before something that's going to truly redensify that skin, that's going to boost the collagen, that's going to create a repair mechanism. And I think that for me was a really amazing upside of this new technology.
So you're absolutely right. I mean, the eyelids is probably the most delicate skin throughout our body. And the reason for that is it does not have a lot of sweat gland, oil gland, and it's very thin. There's no underlying fat in it. That is why if you think about the eyelid, the next one is your neck. It's the same thing.
And
It's
done
very,
too.
very,
I
yeah.
had neck too. And again, I loved it because it is such a delicate area. And I had the transformation. It was really
Mm.
quite transformative for me.
So, I mean, if you look at it, women spend a lot of money on those super rich cream into the eyelids and neck, of course. So this thing like that is what we're trying to do is restore the structure. The other thing, apart from the crepiness, the lines, and the wrinkles that we're looking at is how to do with a dark circle in that region. And in fact, I am in the process or have started the process of looking specific way to deal with what we call an unmet needs. A lot of patients come in, they have a dark circle even at the age of 25, 26, because they are born with a very thin skin. And what we're seeing is the darkish hue of the underlying muscle. These are the individual rely on a lot of makeup and sometimes you can't cover it. There are a lot of things that you can do, but this product, the polynucleotide from salmon, give us a way, hopefully, to inverted comma, thicken up the skin around that area and reduce the transparency. Now,
I just have a question with regards to this because you mentioned it's from salmon. And I wanted to ask you, I've tried a product from Korea and I'm wondering if there is more than one type of treatment in this family. And how do we as consumers know that the product that is being used on us and the product that we are being offered is the safest, is the best, is the most consistent? With food products or say collagen supplements that you take, there is a huge amount of variety of how it's, for example, if it's marine collagen, how is it farmed? How is it stabilized? Where does it come from? And I'm wondering if with this salmon injections, the same holds true and it's important where it's farmed. How is it preserved? What seas does it come from? What kind of salmon it comes from? Does it matter?
yeah, I think like everything, we are using something that we are going to use it on human. Think science matter, where it comes from matter, sustainability matters nowadays. Particularly, I like to think that we're trying to be as environmentally conscious as possible as well. Part of our responsibility as human beings on this planet. We need to go back to history. I think the one that we are lucky, the one that we have in Australia come from wild salmon. They are harvested only once a year, and we harvest them because these are the salmon that will come in naturally. We're not going to go and catch them. They actually come in
So they're
naturally.
not farmed.
They're not farmed, right? This product we're using has been manufactured for the last 10 to 12 years. So we do have a long, long, long safety history, what it does to us as a human being and all this stuff. I am very excited because I'm actually going to go to the farm and as a first-hand experience next month and to see how it's being done. And I'm looking forward to share with you guys the entire process. I think we need to be mindful. So how do we pick it? There are a few other companies around the world that use it. There has been other companies, I believe, using trout. Like everything, once things become popular, you will have other copycats that come to the market and something that they're able to produce faster, cheaper, you name it. We've seen it in every single industry, not necessarily. But for me, at least with our TGA here, we know we have a robust way of screening through who gets in and what gets in. And as a clinician, we also need to be mindful of what we use to our patients. So for now, at least in Australia, there's only one type of salmon DNA that we can use. So that answered part of your question, I believe. Yeah. So we talk about eyelids, we talk about neck, and what we do now too is sometimes a combination therapy
That's what I was
will
going to
work
ask you,
even
because I
better.
think that's you're actually doing a case study, aren't you?
Yeah, yeah.
Combination therapy, and you're renowned for developing many signature treatments that use
Mm,
a combination therapy. And I'm so thrilled you brought it up.
So if you think about combination therapy, any regenerative medicine, particularly the salmon DNA, first of all, they like to heal things. They are a healer. I mean, that's what a stem cell does to us. It's something that we're going to repair. Aging process, most countries, in fact, scientific world, we think of it as a disease state now too, right? I mean, aging process does not necessarily mean just pure aesthetic. We degenerate, our skin degenerate, our
Yes, and
skull
the World Health
degenerate.
Organization has labeled aging as a
Correct.
disease now, finally.
Yeah, yeah. So if we can recognize that, then actively, if you have a heart condition, we like to know the thing that most of us were actively trying to seek some management and some preventative care. So the next big thing is neuro, right? I mean, we all know of someone within our family, friends, we have some degenerative changes to the brain. So that's why longevity, which we will want to talk about, also very important. So this arena is not just about aesthetic, it's all about repair the degenerative changes. So if we can use some sort of devices to create some sort of control injury to the skin, right?
Would that be
Body
like
will,
needling? So if you create some needling and then apply the
yeah, yeah,
polynucleotide over the top of it so that it
correct.
absorbs better.
Yeah. So when we talk about control injury, it can be laser, it can be needling alone, it can be needling with radio frequency to try to improve the skin through this process of inverted comma control precise trauma. But with the added benefit of polynucleotide, you will see this exponential improvement in the skin quality with the hope that we can get a slightly thickened skin that itself reduce the wrinkling and crinkling, but also reduce the transparency of the skin. Now, how good is that going to be? And that's why I'm excited, because this is one of the really truly unmet needs in, at least in my aesthetic world. So I think that's part of the story. We also know that polynucleotide is anti-inflammatory. It has been shown, studies have shown that it perhaps can help repair the skin barrier, right? So think about a lot of individual with rosacea, with a lot of dermatitis, or someone who get red so easily they can't use any skincare product because they are so sensitive.
So,
It's
for
because of
example, I would
dysfunction.
say, if I can say, a perimenopausal or menopausal woman,
Yeah,
inflammation, a change in skin sensitivity, redness is a huge symptom of that transition when the estrogen goes out the window. So, would you
yeah.
say that this would be a suitable treatment for some of those
Correct.
symptoms? Mm.
Correct. So any of the things that we talk about, the seasonal changes, the change of the stage of life changes to the skin, the peri or postmenopausal women, as well as some disease condition of the skin, like any kind of dermatitis, rosacea, for instance, right? So that has been at least studies, the one particular studies from Korea that we have shown to improve it quite well. So that's a skincare period. Once again, is trying to repair the skin barrier disruption. That's exciting. I think we will see a lot more of that. And then from the company's perspective, right, they are also doing intense research on how to actually improve their product. And one of the ways is combine it with, I just can't think of the word, and not a chemical, a natural sugar chain that hopefully not only improve hydration, will actually improve the delivery of the polynucleotide into where we want.
Ready to meet your best self? FutureLab supplements available exclusively at Chemist Warehouse give your body what it needs to stay strong, radiant and ageless. Future Lab's longevity trifecta, NAD+, berberine, and resveratrol work to support the hallmarks of aging from the inside out. We talked about the combined therapy aspect of delivering these kind of new generation regenerative medicine to skin. The way I had it is I had it as an injectable. And, you get the first few days, you look a little bit like alien skin. By the third time I had the treatment, my recovery was really fast. So the first time I had it, I had about 2 days downtime. The second time I had it, I had about 1 day downtime. And the third time I had it, I had like a half a day overnight downtime. But I'm wondering if you could speak to this, because I know that skin and skincare is a huge part of your multimodality practice. And I'm wondering how you feel about this kind of ingredient, this regenerative medicine in skincare. Can it work in skincare? Can we put polynucleotides in skincare and get some kind of result? Just like, collagen we can take as an ingestible, collagen we can stimulate using lasers, using different modalities. Can polynucleotide technology and regenerative medicine technology, does it have a place in skincare as well?
So in fact, the same company that produced the polynucleotide also has what we call a topical, almost like a skincare therapy, is not the same, is PDRN rather than PN. For the audience, it's still fragments of DNA, it's a different reproductive part of the same segment. So you get the same topical. I don't have any experience in the skincare part, but I do heard from my Korea counterpart, they like it. I am always a little bit skeptic with anything like that. The thing is, we need some sort of penetration. And the first thing I want to know is the degree of mechanism for it to actually at least pass through the barrier of the skin. Now, so maybe it's another thing that we can combine with needling and all this stuff that we can actually use it maybe as a mask. So that is still to be seen. I should be able to report back in November.
When we talked about how to get certain regenerative products into your skin and how you would use it in combination with other therapies. Aesthetics 24, for me, the eye-opener that I left with is the massive advancements in multimodality treatment, and the future clinics are going to be heavily invested in multimodality. It won't be enough to go to your corner clinic and have an option of one or two things you can have. You will go to super clinics, is what I can see internationally. And of course, I'd like you to comment on it. Your entire journey will start with a consultation and then completely customized multimodality process. Can you speak to the difference of what multimodality treatment offers a consumer? Because I think that this is something that you're quite heavily invested in, so you're a good person to speak to it. And certainly from Aesthetics 24, that's what you were presenting.
So the multimodality or the new future clinic, in fact, some of it is already here. I think you will get a proper comprehensive consultation. First of all, let's say we concentrate on your aesthetic requirement. The part two will be, we want to talk about the sort of inner longevity health status, because we want you to look good, but also live well longer. So that's the idea behind it. If we touch about your cardiac health, your heart health, your brain health, now we also want to talk about your external health. So that's what the first consultation been. And then we work out the priorities, right? So I see that we will get a concurrent treatment. People will walk out with some sort of maybe supplement that will deal with their internal longevity status, be it the heart, brain, the whole package. And then we talk about the skin health. The skin health will involve a lot of things that we have seen now, your laser devices, your needling, your skincare. I think the skincare is going to get a lot better now. And we recently seen, at least one SkinCeutical, the peptides that we can actually use to deal with some of the surface irregularity and the surface crinkling. And that's very, very exciting. The next step is the regenerative. treatment, the regenerative treatment that we talk about, I think there will be a lot more. Now, we basically also talk about biostimulation. Biostimulation still will have play a new role. There will be a lot better biostimulation to work in combination with polynucleotide, particularly areas that is tough, particularly in Australia. We all love to go out to enjoy the sun, and the bit that suffer is our neck and our décolletage and all this stuff, and that an area that's very difficult to treat. So in future, what we will see is, apart from getting your light laser therapy in that region, you will see a lot of regenerative medicine being placed together with some sort of device, once again, to stimulate your skin. So that, I think, will work extremely well. The next bit that I am excited about is we want to talk about things that will be able to preserve our fat on our face. When I say that, people start to worry. We are not growing your fat. We want to preserve your fat. What it means is, as we get older, the skin become a little bit sometimes not as firm. So there will be at least sometime next year a product coming in that will firm up that little fat. So the best way to think about it is, if you have a daughter who teenagers, or 10,
Which I
9 years old,
look at
or
her
yeah,
all the time and I go,
correct. Correct. Yeah. So it's interesting, isn't it? You'd have to look at a 19-year-old, 20-year-old, and things like that, versus someone perhaps in their late 30s and 40s. If you blank out their eyes, tie their hair up, or even remove their hair, you can tell who is the younger one simply from the surface without touching, and simply because a useful skin and fat looks and feel different. All right. Even if you erase the wrinkles from Photoshop, you can tell which one. Next thing is when you pinch that fat, it is a lot firmer, it has springiness to it, right? So what we will see is the product that will restore some of the springiness within the fat and also preserve the fat. So we're not losing the fat that quickly. And I think if you think that way in combination, now what is exciting now is someone somewhere is working on the bone. So yes, so this is something that we have not been able to deal with. Yes, as a surgeon, we put some stuff almost like bone source replacement on the surface of the bone, and that's fairly invasive. You have to open up the space, scrape the bone, put some almost like a bone source cement to create the scaffolding. So this new product, we're able to reduce the bone loss. It doesn't stop it. I don't think we'll be able to stop aging, but we actually slow down the bone loss. For the audience, it's important to understand that every part of our body, whether it's your skin, fat, muscle, and bone, it goes through a cycle. That is, there's always a replacement, right? And there's always, we produce and then replace it as a cycle, as a cell cycle. As we get older, we continue to lose, and we're not producing that much anymore. So we have a net negative. So our bone continues to shrink. This will slow down the shrinking process of the bone. And I think when we have this, we have a regenerative property for the bone, the muscle, the fat, and skin. Then I think the future is going to be so exciting. We've really got something for the skin, right? This is going to get better. The salmon nucleotide is going to get refinement better. We've really got something for the fat. It is coming. Something to the muscle. We have devices to deal with it. But something for the bone, I think that will be the jackpot.
You talk about this with a huge amount of knowledge, because it's not often that I have a surgeon to speak to, because I think that, the aesthetic on the surface, we've talked about it a lot. We've talked about skincare before. We've talked about devices before. So I'm so fascinated by your insight from beneath the skin's surface. And your conversation around bone density is really important and interesting. I have a question which relates to a topic that I raised earlier, which is perimenopause and menopause. And I'm wondering if you could share with us what you see from the perspective of an aesthetic physician and surgeon, the major changes to a woman's face and skin, and where you feel the most effective intervention is, at what age, at what stage, and with what.
Yeah. So menopause is a big. Okay. So with the loss of estrogen, it really creates not only just the skin, the whole systemic side, and most women expert in it because they go through it. I'm just going to concentrate on the skin. We lost the collagen. We lost the collagen, at least 20% in the first year, and then every few years, every year we continue to lose. As a result, by the end of it, our skin becomes so thin, right? That's only one part of it. The disruption of the skin barrier make life so difficult. You have women whose skin are so good, and then they can use anything, and then suddenly with menopause, suddenly they become allergic to every single thing, and that's because the barrier and all this stuff. So HRT, I believe, is something that are able to really provide so much relief, not only from the symptoms of estrogen loss, but also to the quality of the skin. And that's the number one thing. The second thing is, I think, is to really hydrate and getting some sort of quality skincare that will rebuild that skin barrier is very important. The next thing is do something superficial. We are going back to the polynucleotide now, just to not only restore and improve and repair the barrier, but restructuring the skin so that the skin is not that thin anymore. And I think if we can do all of the above, and of course, a lot of us still like devices, because it's just such a complex thing. One product will not be the only way to deal with it. So regenerative is the key. Now, the other thing that we have not touched on is this thing of exosome, right? Exosome is another key thing. The best way to think of exosome is a supercharged platelet therapy. Right? So if you think of the platelet, that rich plasma that we talk about, essentially it is delivering this to the part of the skin, and then from there it attracts all the growth factors, all the goodies to do what it does, to do some sort of regenerative. But exosome is more like a supercharged PRP, where it has already all these rich growth factors there, and from there it can act directly on the tissue straight away, and in doing so, it also sends a signal to recruit even more to that area. And at the moment, we use it topically, right? Because the research is still going on. So we might do a bit of needling, or we might just put it on the skin to improve the skin. And I think the future, hopefully, we may be able to have something, at least once we get approval, hopefully we might be able to deliver into that area where we need it.
You speak about exosomes, which is obviously part of the regenerative medicine conversation, and the polynucleotides are obviously the future of where we're going. I'm wondering if you could speak to me about development and how they work in the surgical space. Again, I'm fascinated by your view of beneath the skin, and if you see a role for this regenerative medicine as being part of a surgical solution, either prepping the skin before surgery, during the surgery, incorporating it, or after surgery for healing. What is the role of this regenerative medicine in that life cycle?
Okay. First of all, you touch on the preparation. In the last, previously, when you go for surgery, the surgeon say, yes, okay, fine, let's operate tomorrow. Nowadays, there's a lot of preparation going on. We want your skin to be in the best health. When you have surgery, you are going through some sort of injury. We are inflicting some injury. We're making some cut. So those require healing. So the best way, if you want your surgery and your recovery to be so good and seamless, your surgeon will prepare your skin with some good quality cosmeceutical skincare. Now, a lot of us now will, let's talk about facelift surgery. We will, after we prepare, we operate. Some of us may deliver some sort of product into the fat area
During,
just before the surgery,
yes.
to prep the fat so that the fat is kind of ready to receive fat grafting, to improve the uptake of the fat. Now, when we do fat injection to the face, a lot of time only a portion of the fat will survive. So if we can prime your existing fat to receive this fat so that we can grow more blood vessels into the fat transfer, that's going to be a good thing. And that's something that quite a few of us are already doing in the last few years. We do have the product for it. Then we proceed with the surgery. Once we finish closing the wound, some of us already started using exosome as a way to improve healing to the skin. Like everything, every surgery, they do have a slight risk. We want to actually improve the skin quality before as well as just immediately after surgery, so that we get a much faster healing and a much better quality of scar. The bit that we have been using as a surgeon for a long time is fat grafting. We want to improve the contour of the face to replace the fat loss. And part of the good thing about fat grafting, it has so much stem cell. We know that because from years of observation, the skin quality of the skin improves from fat grafting. So we know it works. In the last 10 years, we've been using what we call nanofat, where we crush the fat. We're using all the stem cell within your fat cell, not to plump you up, just to put it in the skin, once again, to improve healing, skin quality, crepiness. If you look at it now, keep talking about regenerative because that is the future. So we're not only using one type of regenerative medicine, which is our own natural fat, we now have the ability of external way of doing regenerative medicine. And I do use it as a combination when I do surgery. I do combine polynucleotide with the nanofat as a way of improving the skin quality and the healing. So the future are bright. The future, that's why it's all about a combination. It's not just one thing.
Dr. Stephen Liew, it was such an honor and pleasure to speak to you. I am endlessly fascinated by this topic, and I have to say that your analogies are so evocative and very, very clear. And I find that a really special quality in my guests, and some guests do it better than others. And I have to say that it was just really, and I'm sure anyone who's listening or watching this episode can attest to the fact that you're a great educator as well as being a great surgeon and doctor, a wonderful educator. And I can see that that's such a passion of yours. So I want to thank you so much for coming on board to educate us on the science of polynucleotides, on the science and the future of clinics and aesthetic medicine, and also the science and future of regenerative medicine. It's been a pleasure to have you.
Thank you so much for having me. It is a pleasure.
Thanks for listening. If you enjoyed this episode, please subscribe to the channel, sign up for our free newsletter, and consider leaving a review and rating it. This really helps the channel grow and reach new audiences.